Thanks for staying with us. Joining us on the show is the head of growth, Octosoft, Celestina Edu. She will be speaking on transforming healthcare accessibility in Nigeria. Welcome to the show.
Thank you very much,
Celestina.
Thank you for having me.
How are you doing today?
I'm fine, thank you.
So Octosoft is the name of the company, right?
That's correct.
Then your product is Octodoc.
Octodoc.
Can you tell us what Octodoc is about?
Okay, so Octodoc is actually one of our health tech products. I'd like to briefly tell you about Octosoft first. Octosoft is a health tech company. We build products for stakeholders in the healthcare space. Okay. So, and these products, we build them to help transform the healthcare experiences for these stakeholders. And when I say stakeholders, I mean hospitals, HMOs, pharmacies, laboratories, so basically the key players in this sector. And Octodoc is one of our products. Octodoc is actually a one-stop shop where users can have all their healthcare needs met. So on Octodoc, you can book appointments with doctors from the comfort of your home. You can have virtual consultations. So you can speak with them, with the doctors, qualified doctors from the comfort of your home. And also you can buy healthcare plans. We have a number of HMOs on Octodoc mobile app. You can choose to buy any plan that you want and, of course, access those plans afterwards.
Amazing.
Okay, so last week we had the CEO of Octosoft, and it was interesting to get the perspective from his end on the solution that Octosoft is providing. But I'm curious about the level of participation you want to get from Nigerians. Like, who are the people that you want to seek your service? And when they hear your explanation, how can they then seek your service?
Okay, so we are targeting the varieties of people. We are targeting users. We're targeting doctors.
Oh.
Yes, hospitals. We are targeting HMOs. And soon we will still target the pharmacies. Oh. So because we're trying to add some additional features that will enable pharmacies to also come on board. So I would speak briefly on how we are targeting these individuals. So for the patients, basically, we're trying to drive convenience, accessibility, affordability, because we charge just about 1,000 naira to see a doctor on Octodoc. That's quite affordable. And we are also trying to bridge that gap that we currently have. At the moment, the doctor-patient ratio is one doctor to over 9,000 patients in Nigeria. And it should be one doctor to just 600. You know, so we're trying to leverage on technology to bridge that gap for Nigerians. So Nigerians can actually download the Octodoc mobile app and speak to a doctor. And we are also opening up the platform, the Octodoc mobile app platform, for doctors from wherever to connect and be on the
So we're going to have international doctors come on board as well.
Please, we have to go on a quick commercial break. We'll come back and continue the show. Stay with us. Thanks for staying with us. We still have our guest, Celestina Edu, here, and we're talking about Octodoc. Ramato, you ready with a question?
It's a very good thing that you guys are doing, because the last time the guy came here, he really gave us a lot of info on what you guys do and also. But there's just this one question I never asked. You guys have products for people with terminal illnesses that they can come on the platform and have doctors talk to them. That's people with terminal illness and all.
Yes, thank you. Telemedicine is actually for primary care. Okay. So we try to ensure we emphasize that, you know. Okay. So for secondary care or for chronic ailments, we usually advise people to go to the hospital. However, we have some doctors that already cater for patients that have chronic ailments. So these doctors actually use the platform, use the Octodoc mobile app to attend to their patients virtually. So that's where the doctors also come in. We have doctors that are on the Octodoc mobile app, and they see their patients with chronic diseases and ailments on the platform.
I think that was very important to highlight because you had said something about chronic care management. But for me, I would like to find out, you had mentioned something about payment. And when the CEO came, he also talked about a wallet, you know, that you can have. Could you help explain to us how, maybe is there money that I can put aside towards consultation, towards treatment using that app? Or how does that work?
Okay, so like I said, we serve different kinds of people. So particularly for the hospitals, they have hospital wallets where they fund their wallets and they are able to come on the platform and attend to their patients, usually patients in the category you just mentioned. And they don't need to charge them because the money is being depleted from their wallet. But for patients that download from the Google Play and iOS, they have to pay out of pocket.
Okay.
And if they have an insurance plan, health insurance plans, they can pay with their HMO plan.
Oh.
Can I just to follow up?
It's okay.
To understand it better. So the wallet is for those who have a plan, or if you've already paid to your hospital, it reflects as a wallet on the app. Is that what you're saying?
No.
Okay.
So the wallet is set up for hospitals.
Okay.
Yeah.
So the app gets a wallet for the hospital.
For the hospital.
Okay.
Because we know they have a lot of telemedicine consultations.
Okay.
You know, but for patients, so there are two ways. You can either pay out of pocket, or you can also use your HMO plan to pay.
Okay. I really love the convenience of this. So I think I have yawned every day I've been on this show, and I've been complaining of cold and all of that. And I know typically I should go to the hospital because I don't want to medicate, but it's the time, the drive time to the hospital has been a major distraction. So here's my question. Let's say I am your potential client and I have your app, and I am thinking of, I would like to talk to an ENT to help me with the nasal congestion I have. What would that process be like? Will I need to first pay to use the app, or I will first get the doctor that I want, or would the app be selecting the doctor they feel is available for me? What would the process be like?
Okay, so the first thing you have to do is, of course, to download the mobile app. Download the Octodoc mobile app and create an account by signing up. Once you sign up, you are able to choose a doctor. So we give you that power to choose a doctor. You have reviews. You can read reviews. You can select a doctor based on the reviews that people have given. Yes. And then you can go ahead to have the consultation.
So do you give like recommendations for the doctors, or
yes,
you just allow us to make our choice?
You're allowed to make your choice.
Okay, so the bio of the doctors,
they
are there. Yeah,
services, and you have to check the
data
reviews first. Okay, this one works, this one doesn't.
Just like when we want to buy products, we check the reviews before we eventually.
Amazing. But let's talk about privacy for a minute. I know that sometimes when you go to the doctors, you expect them to be confidential about whatever they are treating you of. How do you get that level of confidentiality using your app? Since it's open to anybody, how do you preserve my privacy, for instance? Okay,
so it's very important for us to ensure that there's a form of confidentiality when the doctors are interacting with patients. We take it very seriously, especially because we are functioning in the healthcare space. So one of the things that we have ensured is to ensure that the process is encrypted end to end. Okay. Very important for us. And our doctors also know that there are NDA agreements signed, so there are no form of disclosures of anything whatsoever.
How about user friendliness? So a lot of, you would hear about our country, they say a majority of Nigerians are, the right word now, maybe not so educated and may not have access to really good or expensive smartphones. How do you reach, because there's a large number of Nigerians that fall within this category. So what type of phone do you need to have, and how easy is it for a lay user to access your app and interact with the app?
Okay, so it's very important that our users are able to interact with the product that we have built. Extremely important. So the Octodoc mobile app is very user-friendly. Anyone can download and use the app. Like I said just a few minutes ago, all you just need to do is download, sign up, and you have an account.
On what type of device?
On any device, Android, and Apple phones. You can. But for the people that do not have smartphones,
Yes.
what we are trying to do is to ensure that our doctors can also still reach them. So we give them a phone number to call in. Yeah, we give them a phone number. But we like to ensure that there is medical history recorded for them.
Exactly.
So our doctors call them back, so that it's recorded on the mobile app for continuity. Very important for us.
Okay, so I'm happy you went into medical history, because I remember when we had the conversation last, it was one of the things that came up about the fact that many people people's medical history isn't as coordinated as it could be. Case in point, I had my twins at Bagada General Hospital. Then I had the second one at a different hospital, which means that the history they have in Bagada is different from what they have in Ifako General Hospital. So if I now, no, God forbid, I want to have another child, and they want to draw. They want to draw lessons from my experience with my previous pregnancies. They are in different hospitals. Can you talk about how this app would be harmonizing the medical records of people and the advantage of having that together?
Okay, so
God forbid.
So what we are trying to do is to also ensure that we have a number of hospitals. So if the example you just gave, if we have Bagada General Hospital on the platform and we have the other hospital on the platform, it's easy for the data to synchronize. That's why we are really asking for hospitals to come on board, come partner with us. Have the Octodoc mobile app as your telemedicine platform where your patients can interact, so that even if they move from one hospital to the other, there's still that
They need to pay to sign up.
No, sign
Hospitals
up is free.
themselves.
The hospitals.
Sign up is free.
Okay.
Sign up is free.
Even general hospitals.
Sign up is free.
Wow, that's good.
Interesting.
So for the people at the lower parts, the people that should, the lower part that should access the medical wherever and everything, what I'm just going to ask is, what kind of awareness are you creating to get to the people at the
grassroots?
Yes, at the grassroots.
Yes. We are doing a lot of awareness. We are going to hospitals, to PHCs, and where we can really find these people. We are starting some campaign, and we'll be visiting the markets. These are the places we will see these people. And majority of them actually need this service, especially because it's quite affordable, to speak with doctors on the Octodoc mobile app. And it's cost just 1,000 naira. You can see a qualified, as against going to a chemist and just buying drugs that you're not even sure.
Okay, so now, on this affordability, I pay 1,000 naira to see a doctor, and then I get a diagnosis.
Follow up.
And I need to buy those drugs. How do I get those drugs cheaper than what I would have gotten ordinarily? Or I should go out and source myself again, like going to a regular hospital?
Okay, so for our HMO partners, we send the prescriptions to them, and yes, we have HMO partners. We also serve HMOs.
Yeah, you said?
Yeah, so we send the prescriptions to them, and they send it to their partner pharmacies. Of course, they tidy up. But for regular users that download, we ask them the pharmacies that are closest to them. And yes, because we also have a knowledge of this network of pharmacies. And we also advise, okay, this is your prescription. Kindly go.
How do you ensure that so is the price of the medication now I'm worried about?
Oh, we have no control over
that. But I just could you also clarify, because when you say 1,000 naira, because I know sometimes you go to some hospitals, they have different consultation fees. Is this 1,000 naira consultation fees for any hospital or doctor that I see, or just the 1,000 naira to use the app to be able to see a doctor who may charge me for consultation?
So the 1,000 naira is the consultation fee.
Oh, now wow, we have to get on this app.
Okay, so let me ask this
However,
question.
For the hospitals that are on there, they charge their own consultation fee.
That's exactly what you just said.
No, if you want to use the hospital, but if you go on the app, like because I want to be sure that we're getting
it right.
If I sign up on the app and I want to see a doctor and I check the doctor and I pay my 1,000, I can talk to the doctor, even though the doctor is probably working with saying something.
No. So on the Octodoc mobile app, we have the Octodoc doctors.
Okay.
The Octodoc doctors are the ones that you pay 1,000.
Consultation.
But the hospitals that are coming, they come with their charge because we cannot dictate
for them.
Yes, so they say,
So I cannot sneak and go and use some
how
sense,
available, how available are your Octodoc doctors? How many of them do you have to service the people if I insist I want them because I only have 1,000 naira to pay?
Yeah, so we have a number of in-house doctors. We call them in-house doctors.
Okay.
Yes, and they work 24/7. They have a shift that goes round the clock. So
they have enough hands.
Yes.
Okay, so if, for example, I come on the app and I get a diagnosis and they tell me to go to a lab for a blood test or stool test, any of those, and I get the result, am I going to get the result and come and upload it so that the doctor?
Yes.
Okay.
There's a place where you upload the results and the doctor sees it immediately at his end.
Are there Octodoc
Octodoc
labs?
doctors?
No, I mean, are there Octosoft labs? Are there?
No.
Okay.
So what we do, we have a partnership running with network of pharmacies, network of laboratories and hospitals, HMOs. So you can choose. The power is in your hands. You can choose to have a consultation with the Octodoc doctors, or probably you have a favorite doctor in a hospital that you're familiar with. You can choose to have a consultation with them. But then the prices would differ because they would definitely have a charge for their telemedicine price.
Thank you so much.
Thank you.
For joining us today. We've been speaking with Celestina Edum, the head of growth, Octosoft. Thank you for sharing with us what Octodoc is about, and hopefully we'll get a lot of people to sign in.
Just before I go, we have a promo code for people that download the app right now.
Oh, because they're watching your view.
Yes.
Amazing.
So just go straight to Google Play and Apple Store, download Octodoc, OCTODOC. Sign up and create an account. You see a space that says referral code. Please put in your view as one word. Your view as one word, and you will get instantly 3,000 naira to speak.
In your wallet.
Yes, in your wallet to speak with a doctor. So that you get 3 sessions. Actually.
Amazing. What's the window for this? Just today?
Today.
Just today.
Just today.
All right. So fans
just
out there, this is an opportunity for you to get 3,000 naira on this.
People.
Yes, only for 50 people.
Only for 50 people.
Amazing. Thank you so much, Celestina.
Thank you. Thank you for having me
again.
Thank you.
Sometime soon.
Thank you.
That's all we can take on this segment. When we come back, we move on to yet another segment. Stay with us.
Stay tuned. Your View will be right back.